Good morning, everyone. How are you today? Today, I will be talking on ulcer, prevention, management, and treatment. What is ulcer? Generally speaking, anytime you mention the word ulcer, it means wound on the surface. But when it happens in the gut, that is in our intestine, it is called gastrointestinal ulcer. This gastrointestinal ulcer can be peptic ulcer, and the peptic ulcer will be called gastric ulcer if it happens in the stomach. But if it happens in the small intestine, that is at the junction between the stomach and the small intestine, it is called duodenal ulcer. That is ulcer at the duodenum. Large intestine also have ulcer, but this is the premise of bowel inflammatory diseases. So we are not going to be talking about that today. We are only dealing with peptic ulcer disease. So what is peptic ulcer disease? Is defined as a circumscribed ulceration of the gastrointestinal mucosa occurring in areas exposed to acid and pepsin, and most often caused by Helicobacter pylori infection. I tell you, for most of us, we are hearing the word Helicobacter pylori for the first time. It is a bacteria that lives inside the gastrointestinal system that can predispose somebody to having ulcer. Before, now we talk about management of ulcer. That is, people, it's like ulcer cannot be cured, but it can be managed. But with the discovery of H. pylori and its eradication techniques, it is possible to cure ulcer totally. And when we follow strict lifestyle modifications, then we can keep ulcer at bay forever. So today we'll be talking about actually cure, management, and treatment of ulcer. Let's compare duodenal ulcers and gastric ulcer. For duodenal ulcer, they are usually common around middle age, between the age of 30 and 50, occurs 4 times in male compared to female, and H. pylori infection is common and is common twice in smokers. For gastric ulcer, the incidence also increases with age, and male to female ratio is 2 to 1, and more or less is associated with the use of non-steroidal anti-inflammatory drugs. Also, is less related to H. pylori than duodenal ulcer. Sometimes, up to 10 to 20% of patients with gastric ulcer also have duodenal ulcer. So let's look at the causes of the ulcer. Like we have said, a peptic ulcer is a mucosal break of 3 millimeters or greater that can involve stomach or duodenum. And the problem or the things that cause this ulcer is number one, H. pylori infection, the NSAIDs or pain relieving drugs, non-steroidal anti-inflammatory drugs. Then acid secreted in the stomach is also a cause. And pepsin. Pepsin is the enzyme secreted by the stomach to digest protein. So when you have these four, you are seeing ulcer coming on board quickly. Now, there is always a balance between the aggressive factors and the protective factors in the stomach, in the lining of the stomach, so that there is nothing like ulcer. So let's look at the aggressive factors apart from the four we've mentioned above. These aggressive factors also include smoking, drinking, that is ethanol, bile acid, use of aspirin, steroid usage, and also stress. Stress leads to production of more histamine, and which leads to production of more acid in the stomach. Now let's look at the protective factor. Protective factors are mucus, which contain bicarbonates, mucosal blood flow increase, prostaglandin secretion, and hydrophobic layer and epithelial renewal of the stomach. When there is an imbalance, then peptic ulcer disease may develop. Anything that tilts the balance by increasing acid secretion or reducing mucus secretion will cause ulcer. So let us look are these conditions which include stress, which leads you to produce more acid, like I've said before. And this is even worse when your stomach is empty, when you are not eating anything. Also, too much of coffee or caffeine may lead to a production of acid in your stomach. Taking NZ, like I've said before, decreases the production of mucus layer. Fried foods, free radicals from fried food, free radicals also stimulate more acid production. And taking of pepper, especially in the African setting, and the rest of alcohol also stimulate the production of excessive acid. These are general summary of causes of peptic ulcer disease. So let's look at the symptoms of ulcer. The first thing you see is pain. People present with pain, gnawing, aching, and burning pain. The duodenal ulcer, in the duodenal ulcer, pain occurs in 1 to 3 hours after meal and may awaken patient from sleep. And when you eat, uh, the food also relieve the pain. Then you can use antacid, or sometimes you have to vomit to get rid of the acid, to get rid of the pain. But for gastric ulcer, food may exacerbate the pain while also vomiting relieves it. So pain is one of the symptoms of ulcer. Another one is nausea, vomiting, belching. Dyspepsia means indigestion due to excessive acid, bloating, chest discomfort, anorexia, hematemesis, which means vomiting of blood, or melania meoca, which means blood in the stool, usually dark blood, not fresh blood that they are red. This one are dark clotted blood that are produced from the stool because of the internal bleeding from the upper surface from the gastrointestinal tract. Also, we see following the nausea and vomiting, weight loss is more common with gastric ulcer. Differential diagnosis. What are the conditions that look like ulcer but they are not actually ulcer? Neoplasm of the stomach, that is cancer of the stomach. Pancreatitis, inflammation of the pancreas. Pancreatic cancer. Diverticulitis. Then we have non-ulcer dyspepsia, also called functional dyspepsia, that is indigestion and excessive acid situation not related to ulcer. Cholestasis, gastritis, and GERD, that is gastroesophageal reflux disease. And also myocardial infarction, MI, may not be missed if having chest pain. So how do we confirm ulcer? The best test now is this fecal occult blood. Then you can use the urea breath to confirm the presence of H. pylori. And the equipment that is used most commonly is the endoscope. So upper GI endoscopy allow us to view inside your intestine and see where the ulcer are located. So now, treatment of H. pylori. Normally, treatment. When you are treating, there are two plans. Is H. pylori present? If yes, then this is the plan you follow. You have to take a triple therapy combination for 14 days. This involves proton pump inhibitor and 2 antibiotics, usually clarithromycin and amoxicillin. Then it can be amoxicillin plus metronidazole with the proton pump inhibitor. The common proton pump inhibitors we have are omeprazole, lansoprazole, rabeprazole, esomeprazole, and the prazoles of this world. The goal of these 2 weeks, 14 days, triple combination of these antibiotics and proton pump inhibitor is to make sure H. pylori is totally eradicated. If no H. pylori is present, then we have to just use proton pump inhibitor to make sure we reduce the acid secretion and allow the wound to heal. Other anti-secretory agents that we can use are the H2 receptor antagonists like cimetidine, ranitidine, and other proton pump inhibitors also can be used in this particular regard. Now, we cannot just be taking drugs all the time. What are the lifestyle changes that we need to undertake to make sure that we are able to heal the ulcer and do not allow it to return? Number one, discontinue non-steroid anti-inflammatory drugs usage. Things like diclofenac, ibuprofen, naproxen, all these pain relievers should be avoided. The mildest of them on the stomach is paracetamol, or what we call acetaminophen. Then we should, like, if you have pain, it's better you take antacid for acid suppression. If you're a smoker, stop smoking totally, and also take alcohol in what? In moderation. You must also have a way of reducing your stress so that you don't secrete excessive acid. Let's look at lifestyle modifications. Treatment is simple since we know what causes ulcer. Therefore, we just have to modify our lifestyle to avoid these conditions. Food that are alkaline and rich in both soluble and insoluble fibers will help neutralize the acid and form a thick mucus layer on the gut. So, example of these foods are chitin, uh, nuts, unripe plantain, whole grains, vegetable are all examples of fiber-rich food that can help us prevent the formation of ulcer. Now, if ulcer is left untreated or managed, there are some complications that can arise. Example of such complication is perforation and penetration into pancreas, liver, and retroperitoneal space, which can lead to infection and a lot of problems. Then we have peritonitis. Then there can be adhesion leading to bowel obstruction, gastric outflow, and pyloric stenosis. Bleeding also occur in about 25 to 33% of cases and account for 25% of ulcer death. And also it can lead, if untreated, to gastric carcinoma. This is just the general summary of what we can do about ulcer. For those of us that are in alternative medicine, we find some supplements, and the major drive of these supplements are the content of their soluble fibers. You have things like chitin, that is a form of that is chitosan in generic form that is called. You have both soluble and insoluble fiber in some supplements that help to form a thick lining of mucus upon the ulcer surface, preventing acid irritation, allowing total healing. Then, since we said the rapid growth of this intestinal lining is essential to ulcer healing, zinc has been known to help to increase the rapid rate of intestinal cells division. This allows the healing of the ulcer to take place quickly. Thank you. This is the end of this particular video training slide on ulcer.